Have you been told not to scratch by your doctor? Well, I just had a patient this week scolded by her dermatologist and told stop scratching. It's causing a lot of damage to your skin. And in fact, scratching is not good for your skin. We all understand that. The problem is when you have an intense desire to scratch, which is what we refer to as itch, it's virtually impossible not to scratch. You might be able to temporarily suppress it, but chronically you cannot suppress scratching in response to an itch. So the more productive way to think about this is to actually think about how can we actually find the cause of the itching? How can we alleviate the itching? So now, why does scratching actually cause more itching, and why is that so bad? Well, when you have an itch, what happens is that you actually scratch. The scratching causes damage to the skin barrier where the nerves are. It causes inflammation, and this triggers more itching. If we can disrupt this itch-scratch cycle, that's the ideal situation. But telling someone to just simply stop scratching will not work. So if you do see a provider or a dermatologist that tells you to stop scratching, one thing I suggest to my patients is to reorient them and say, I really cannot stop scratching. This is simply a reflex. I'll do it in my sleep, unbeknownst to myself. Can we focus, rather than on me not scratching, can we focus on what is actually causing the itching? And what are the treatments that you could provide to help alleviate that? And thereby we can now prevent me from scratching. So to my dermatology colleagues, I completely understand why we would tell our patients to stop scratching. In fact, I feel the urge to tell them that too. And honestly, the times that I feel that the most is when I cannot figure out why the patients are scratching. But invariably, there is ultimately a cause to itching, whether it's neurologic, whether it's inflammatory, even if it's idiopathic or unknown cause, we'll eventually be able to figure out a way to get them better. And what I try to do is focus my attention entirely on that rather than on whether the patient is scratching or not.